Proper patient positioning is paramount in healthcare settings. It forms the bedrock of patient comfort, safety, and effective medical intervention. By ensuring patients are correctly positioned, healthcare professionals contribute significantly to positive patient outcomes. This guide delves into the nuances of various patient positions, highlighting their applications, benefits, and step-by-step procedures for healthcare providers. Positioning is not merely about comfort, it directly impacts physiological function. Correct positioning can optimize respiratory effort, improve circulation, and prevent pressure ulcers. Conversely, improper positioning can lead to complications, including respiratory distress, skin breakdown, and nerve damage. Understanding the principles and techniques of patient positioning empowers healthcare professionals to provide optimal care. It ensures patient dignity and well-being while facilitating medical examinations, treatments, and surgical procedures. This comprehensive guide will equip healthcare providers with the knowledge and skills to master patient positioning, ultimately contributing to enhanced patient care and recovery. The supine position, commonly known as lying flat on the back, is a fundamental position in healthcare. It is one of the most basic and frequently used positions in medical settings, serving as the starting point for numerous medical examinations and procedures. This position is not only comfortable for the patient, but also provides healthcare providers with optimal access to various parts of the body. It serves as the starting point for numerous medical examinations and procedures. For instance, during a physical examination, the supine position allows the doctor to easily inspect the patient's chest, abdomen, and extremities. Understanding its applications and proper execution is crucial for any healthcare provider. Proper positioning can significantly impact the accuracy of diagnostic tests and the effectiveness of treatments. The supine position offers a clear view of the anterior aspect of the body, making it ideal for examining the chest, abdomen, and extremities. This position is particularly useful for procedures that require access to the front of the body, such as abdominal surgeries or cardiac assessments. It facilitates procedures such as electrocardiograms, intravenous catheter insertion, and central line placement. These procedures are critical for monitoring and managing a patient's health, and the supine position ensures that they can be performed safely and effectively. Steps for supine positioning. Ensure the bed or examination table is flat. This is the first and most important step to ensure the patient is comfortable and properly aligned. Gently assist the patient in lying on their back. It's important to support the patient's head and neck as they transition to this position to prevent any strain or discomfort. The patient's head should be supported by a pillow. This helps maintain proper alignment of the spine and ensures the patient is comfortable during the procedure or examination. Arms can be placed comfortably at the sides or across the chest. The choice depends on the procedure being performed and the patient's comfort. A small pillow or rolled towel under the knees can alleviate lower back strain. This simple adjustment can make a significant difference in the patient's comfort, especially during longer procedures. The supine position, while seemingly simple, is essential for numerous healthcare interventions. Its proper use can enhance patient comfort, improve procedural outcomes, and reduce the risk of complications. Its versatility and accessibility make it a cornerstone of patient care. Whether for routine examinations or complex procedures, the supine position remains a vital tool in the healthcare provider's arsenal. The prone position involves positioning the patient on their stomach, a technique that has been utilized in various medical settings for its numerous benefits. With their head turned to the side to ensure the airway remains open and unobstructed. While often associated with discomfort, the prone position plays a vital role in specific medical situations, particularly in respiratory care and wound management. This position is especially crucial for patients who are experiencing severe respiratory issues, as it can significantly aid in their recovery process. For patients with acute respiratory distress syndrome, the prone position can improve oxygenation by enhancing lung mechanics and gas exchange. By lying on their stomachs, patients can experience better ventilation and perfusion, which are essential for effective breathing and oxygen delivery to the body. It is also beneficial for patients recovering from certain surgeries, promoting drainage and reducing pressure on surgical sites. This can help in faster healing and reduce the risk of complications such as infections or pressure ulcers. Steps for prone positioning. Ensure the patient is comfortable with the idea of turning onto their stomach. It's important to explain the procedure thoroughly to the patient and address any concerns they might have. With assistance, gently roll the patient onto their stomach. This should be done carefully to avoid any strain or injury, and it's often a team effort involving multiple healthcare providers. Use pillows to support the head, chest, and lower legs, ensuring the airway remains open. Proper support is crucial to maintain comfort and prevent any pressure sores or discomfort. Regularly assess the patient's comfort and make any necessary adjustments to positioning. Continuous monitoring is essential to ensure that the patient remains comfortable and that the position is effective. While the prone position might not be the most comfortable for extended periods, its targeted benefits in specific medical situations make it a valuable tool in a healthcare provider's arsenal. By understanding and implementing this technique, healthcare professionals can significantly improve patient outcomes, particularly in critical care settings. Section 4. Lateral Positioning, Promoting Comfort and Stability. The lateral position, or side-lying position, is a versatile and frequently used position in healthcare. It promotes patient comfort, reduces pressure on bony prominences, and facilitates various medical interventions. This position is particularly beneficial for patients at risk of pressure ulcers, as it distributes weight more evenly. It also aids in preventing aspiration, especially in patients with swallowing difficulties. Steps for lateral positioning. Assist the patient in lying on their side. A pillow should be placed under the patient's head for support. The top leg should be bent and supported by pillows to maintain spinal alignment. A pillow can be placed behind the patient's back for added stability. The lateral position's versatility makes it a cornerstone of patient care, promoting both comfort and safety for individuals under various medical circumstances. Section 5. Fowler's Position, Enhancing Respiratory Function and Cardiac Output. Fowler's position involves elevating the head of the bed to a specific angle, typically between 45 and 90 degrees. This position is named after George Ryerson Fowler, an American surgeon who popularized its use in the late 19th century. The angle of elevation can be adjusted based on the patient's specific needs and medical condition. This position is frequently used to improve respiratory function, particularly in patients experiencing shortness of breath. By elevating the head and upper body, Fowler's position helps to reduce the pressure on the diaphragm, making it easier for the lungs to expand. This is especially beneficial for patients with chronic obstructive pulmonary disease, COPD, asthma, or other respiratory conditions. Elevating the head and torso in Fowler's position helps to expand the chest cavity, facilitating lung expansion and improving oxygenation. This position also promotes better airflow and reduces the risk of aspiration, which is particularly important for patients who have difficulty swallowing or are at risk of choking. It also aids in digestion and promotes drainage after abdominal surgery. By keeping the head elevated, Fowler's position helps to prevent the buildup of fluids in the abdominal cavity, reducing the risk of complications such as pneumonia or atelectasis. Steps for Fowler's positioning. Gradually elevate the head of the bed to the desired angle, typically between 45 and 90 degrees. It's important to do this slowly to ensure the patient remains comfortable and to avoid any sudden changes in blood pressure or heart rate. Use pillows to support the patient's head, neck, and arms. Proper support is crucial to maintain alignment and prevent strain on the neck and back. Pillows can also be used to support the lower back and knees, providing additional comfort and stability. Ensure the patient's spine is straight and their body is well supported. This helps to prevent pressure sores and other complications associated with prolonged bed rest. Regularly check the patient's skin for any signs of redness or irritation. Regularly assess the patient's comfort and make any necessary adjustments to positioning. This includes checking for any signs of discomfort or pain and making sure the patient can easily reach the call button and other essential items. Fowler's position is a valuable tool for enhancing respiratory function and overall patient comfort, particularly in settings where breathing difficulties or cardiac output optimization are primary concerns. By understanding and properly implementing this positioning technique, healthcare providers can significantly improve patient outcomes and quality of life. The Trendelenburg position involves placing the patient flat on their back, a common practice in various medical settings. The head of the bed is lowered, creating a downward slope, and the foot of the bed is elevated, raising the legs above the level of the heart. This creates an incline with the patient's head positioned lower than their feet, which can be crucial in certain medical scenarios. This position is often used during emergencies and certain medical procedures such as surgeries or when a patient is in shock. The Trendelenburg position offers several benefits, making it a valuable tool in the medical field. It helps improve blood flow to the brain in cases of shock, which can be life-saving. It can also help with low blood pressure by promoting better circulation throughout the body. Additionally, this position can assist with abdominal surgery, providing better access for surgeons. It helps by shifting abdominal organs away from the surgical site, reducing the risk of complications. However, the Trendelenburg position is not suitable for all patients and must be used with caution. It can cause respiratory distress in some individuals, particularly those with pre-existing conditions. Prolonged use can also lead to increased pressure in the head, which can be dangerous. Therefore, it is essential for medical professionals to carefully evaluate each patient's condition before deciding to use the Trendelenburg position. Understanding the kidney position. The kidney position, also known as the lateral decubitus position, is used for procedures involving the kidneys. This position is crucial for providing surgeons with the best possible access to the kidney area, ensuring that they can perform the surgery with precision and efficiency. The patient lies on their side with the affected kidney facing upwards. This orientation helps in isolating the kidney and making it more accessible for the surgical team. The knees are bent and a pillow is placed between the legs for support. This not only provides comfort, but also helps in maintaining the correct anatomical alignment during the procedure. This position provides optimal exposure of the surgical site. It allows the surgeon to have a clear and unobstructed view, which is essential for the success of the operation. The kidney position is commonly used for kidney surgeries, such as nephrectomies and kidney stone removals. These procedures require precise movements and access, which this position facilitates. It allows surgeons to access the kidneys more easily. The lateral decubitus position ensures that the kidney is prominently positioned, reducing the need for excessive manipulation. The kidney position also minimizes the risk of aspiration during surgery. This is particularly important for patient safety, as it reduces the chances of complications arising from the inhalation of fluids. However, prolonged time in this position can cause discomfort and pressure sores. These are areas of concern that need to be monitored closely by the medical team. Padding and frequent position changes can help alleviate these risks. By using adequate padding and adjusting the patient's position periodically, the medical team can ensure the patient's comfort and safety throughout the procedure. Significance for healthcare professionals. Mastering patient positioning is essential for healthcare professionals. Proper positioning ensures patient safety, comfort, and optimal surgical outcomes. Understanding the lithotomy, Trendelenburg, and kidney positions, along with their uses, benefits, and risks, is crucial for nurses, surgeons, and other healthcare providers. By applying this knowledge, healthcare professionals can provide high-quality care and improve patient outcomes.